Hi guys, I'm Kira and we're going to talk about posterior hip arthroplasty post-surgical precautions. So there are several reasons a patient might undergo a hip arthroplasty, including osteoarthritis, rheumatoid arthritis, osteonecrosis, or a hip fracture. There are several different types of hip arthroplasties. We're going to do a quick review. These include hemiarthroplasties, which is when the surgeon replaces the femoral head, neck, and stem, but leaves the acetabular cup intact. And then the total hip replacement, which is where the surgeon replaces the acetabular cup, femoral head, neck, and stem. And there are several approaches to a hip arthroplasty, including an anterior approach, a posterior, and lateral approach. For today's purposes, we're going to be talking about a posterior approach. So this is just a visual representation of a total hip replacement. So you can see here that the acetabular cup has been replaced, the femoral head, neck, and stem have also been replaced. And then here is one more visual representation of a posterior approach incision. In a posterior approach, the tensor fascia latae muscle is incised and the gluteus maximus fibers are split to detach the short external rotators of the hip. During the arthroplasty, the surgeon actually dislocates the hip, which explains the increased risk for hip dislocation following the procedure. So post-surgical precautions of a hip arthroplasty include not flexing the hip past 90 degrees, not internally rotating the hip past neutral, and not adducting the femur past the midline. And these are generally followed for about 3 months following procedure, but it can vary depending on the patient. So one activity that is affected by the post-surgical precautions is bending down to pick something up off of the floor. So here we can see the act of bending down to pick up a remote off of the floor, and we see that the hips are flexing more than 90 degrees as we reach down to pick up the remote. So one way we can modify this movement to meet our post-surgical precautions is to move our affected leg behind us before we reach down to pick our item off of the floor. You can see in the video that as I reach down to pick up the remote, my hip is not flexing past 90 degrees, keeping me within that safe space for the post-surgical precautions. If this is difficult for the patient, they might consider using a grabber or using a chair as extra support. I did want to mention that one more movement that a lot of patients, or all patients, are going to be experiencing is getting up and down off of the toilet. And in order to keep their hip from flexing 90 degrees during this movement, the patient is going to want to use a raised toilet seat.